In life, we prepare for everything: college, marriage, having a baby, retirement. But too often, we don't have conversation about the end. We're here at Lower Cape Fear Hospice and Life Care Center to find out how we can take that first step to begin the conversation. Jason Clem is the Director of Community Outreach here at Lower Cape Fear Hospice and Life Care Center. Now, Jason, can you first explain what the Begin the Conversation campaign is?
I sure can. As you mentioned, we realize that end of life is not something that a lot of people want to talk about, that it is a difficult thing, but we also realize that with a lot of the families that we serve, those who are able to do that, it can be a real benefit not only to the patient whose wishes are needing to be followed, but also to the family as a gift to them. So we created this program, Begin the Conversation, as a public education initiative to provide people with information, awareness of what decisions can be made and how to do that, but also to open up the lines of communication and encourage them to have these conversations with their family, with their friends, physicians, of course, even clergy and other people who would be involved in that sort of scenario.
Now, most of us probably think that we don't have to talk about end-of-life care until we're much older. Should someone my age be thinking about this too? Well,
in my opinion, yes. I actually speak to some schools, UNCW, and some area colleges, and encourage them, even at that age, that you're an adult, you can make these decisions. Unfortunately, we're not guaranteed tomorrow, and that we're talking about things beyond illness. There's things like accidents and other things that would cause people to need this information and this communication to already happen. We created a website called begintheconversation.org, and it's a place where you can go in the comfort of your own home 24 hours a day and find out some information. We've put the actual North Carolina Living Will and Healthcare Power of Attorney on there for people to download and look at and fill out. We've included a toolkit with some questions and topics that people can talk about. We also included some links to other information and readings and testimonies of people that have gone through this sort of thing. For those into social networking, we even have a blog, and we have a Facebook page that people can interact with us on. We also are able to take this information out to the community. So if there are any groups, church groups, civic clubs, schools, businesses who would like to bring this information to their members, we also occasionally have workshops and conferences that people can attend free of charge to get the information as well. Please feel free to also give us a call or email if you have any questions by looking on the website, and we would be more than happy to get the information too.
Okay, wonderful. Thank you, Jason. Gwen Whitley is the Vice President of Clinical Services at Lower Cape Fear Hospice and Life Care Center. Now, Gwen, we were just talking with Jason about the importance of taking steps to begin the conversation. What do we need to discuss with our doctor?
It's very important to discuss with your physician what your wishes are as far as your healthcare choices. And when we talk about healthcare choices, we talk about what type of treatments we want as patients, what kind of treatments we do not want to have. Healthcare choices are very important if you begin to face a life-limiting illness, if you are in a severe accident, that your physician knows what test, what treatments you want, and what you want to have done for yourself and not your family having to decide. Let your physician know what the advanced directives that you want to have modeled for you personally. You're able to then name someone that would be your healthcare power of attorney.
Why is it important that we have this plan in writing?
That's what the physicians will abide by. It's documentation. It's very hard for families to say, I think this is what this patient would have wanted or my loved one would have wanted. We act on many different levels as far as health care. We're not just about hospice. So I would encourage anyone to call our number if they feel like that they have a patient, family, friend, family member that needs hospice or some type of medical services. We'll have a discussion with anyone in the community, the physician, just to try to navigate the healthcare system to see what services that will best meet the patient's needs.
Okay, Gwen, very important information to know. Thank you very much.
Thank you.
Don't wait any longer. Now is the time to begin the conversation. Spread the word. Be one of the 30,000 to sign up. It truly is a gift. I'm Suzanne Gillott for Cape Fear Now.